Our presentation today is going to cover infant oral health, both from a parent's perspective and from a pediatric dentist's perspective.
No, haven't you forgotten to brush your teeth?
My teeth?
They're those hard little white things inside your mouth.
I know what my teeth are. It's just that sometimes I don't feel like brushing them.
But, Bobby, we must take good care of our teeth. They're very important.
Hi, I'm here with Mrs. B to get a parent's perspective on infant oral health. I just have a few questions for you.
Okay.
So, your child is 17 months old. Has she had her first dental visit yet? And do you think it's necessary to establish a dental home by 12 months?
She has not had a first dental visit yet, and I wouldn't say it's necessary to establish a dental home at this point. I'd say coming up soon, though, we would go see the dentist once she has the patience, I think, to sit and have an exam.
And in regards to her overall health, where do you think you will take her for her dental visits?
Well, I have a dental clinic that I go to in town, so I'd probably just take her there. At 18 months, she has a checkup for her 18-month wellness check at the normal doctor's clinic, and so there I'd probably ask what my pediatrician's recommendation is as far as seeing a dentist.
And what is her daily oral health routine?
Right now, it's just brush her teeth at night. She has a little electric toothbrush that she likes to brush her teeth herself with.
Okay, and how has your own relationship with your dentist affected your view of your child's health?
Well, I've never been afraid of the dentist, and I always thought it was a good thing to go. My dad and mom always took us regularly as we were growing up, so I think it's obviously an important part of health.
Well, thank you for giving us your opinions on infant oral health.
There are other things you can do, too.
Like what?
For one thing, you can let a grown-up help you take care of your teeth.
A grown-up? You mean like a firefighter?
No, firefighters have nothing to do with teeth, Bobby.
Oh, yeah.
Unless that firefighter is your mom or dad, they can help you brush your teeth to make sure they are as clean as they can be.
I bet firefighters would be good at rinsing.
We also interviewed a pediatric dentist and received the following recommendations. When should parents establish a dental home and why?
As soon as possible, but preferably by 6 months of age or before the first tooth eruption. This allows us to educate the parents to prepare for that first tooth eruption, which usually occurs around 6 months of age.
What are the steps for successful infant oral health examination? We must use different techniques, such as knee-to-knee, which you can see in the picture below, board or lap examination, where the parent holds and bear hugs the child. This also allows opportunities for the parents to be actively participating in our examination. We must also gather critical information from the parents, such as oral habits, diet, development, and method of birth, which can impact the transmission of bacteria. What is the recommended oral health routine for infants? We must educate on anticipatory guidance, such as good habits versus bad habits and good diet versus bad diet. Always remember to tailor your recommendation based on family life, mother's oral health, infant's age, and many other personal factors.
Important. You see, we use our teeth every day. They help us chew and eat our food.
That's true.
And did you know that our teeth help us talk?
They do?
The next question we asked Dr. McGuire was how our parents' relationship with their dentist affected their view of their child's oral health, and she revealed that it greatly influenced the child's oral health. She said that the best thing that we can do is early preventative care, which is educating the mother while she's still pregnant with a child about her child's oral health. Dr. McGuire recently read a journal that talked about how a happy parent had better compliance with oral health recommendations for their child. This meant that the parent was more likely to help the child brush their teeth and bring their child to the dentist if they were happier. Another thing that we need to think about with the parent and the child is vertical transmission. So being aware of the mother's caries activity is really important because the child's strep mutant makeup is very similar to the mother's. The last thing that we asked Dr. Mugaya was whether it was okay for parents of infants to receive the majority of their oral health guidance from pediatricians, and frankly, she loved this idea. As we heard from the parents' interview, the parent is more likely to take their infant to the pediatric doctor than the dentist, so it is our job to teach pediatric physicians about anticipatory guidance and for searching for the signs for early childhood caries so we can work together to improve the infant oral health and establish a relationship for referral as well.
There are other grown-ups who can help take care of your teeth too. Dentists, hygienists, doctors.
Firefighter? Oh, never mind.
So remember, always let mom or dad help brush your teeth.
Okay, I'll go get my mom now.
It's evident that establishing a good relationship with a dentist is crucial for maintaining an infant's oral health. We wanted to leave you all with some things to keep in mind in order to keep a child's mouth as healthy as it can possibly be. Thanks for watching, and we hope you learned a thing or two about infant oral health.